this health sketch, we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini-stroke, or TIA. Often, symptoms only last a few minutes, but just like with a full-blown stroke, you must go to hospital immediately if you suspect a TIA. This is because a TIA is a warning sign that you're at high risk of having a full stroke. Whether you have a TIA or a full stroke, daily medications are started and continued lifelong to help prevent further episodes. The effects of a stroke can be disabling, but given time, the brain can slowly adapt to recover some previously lost abilities. This is why stroke rehabilitation is so important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support. We've talked a lot about strokes, but what can we do to prevent them from happening? Even if you've already had a stroke in the past, there are many small steps we can all take to reduce our future risk of having a stroke, such as lowering high blood pressure, the #1 cause of stroke, stopping smoking, lowering cholesterol, being more active, eating healthily, lowering alcohol intake to within recommended limits. If you have diabetes, keeping good control of blood sugar levels. In this health sketch, we've talked about what a stroke is, how to spot the key symptoms, and the need to act fast. We've also talked about treatments, rehab, and the steps we can take to prevent strokes. We hope this health sketch about stroke has been helpful for you and those around you. Health Sketch. Health for all to see.
Alright, eating a healthy diet that includes a variety of fruits, vegetables, fish, and other lean meats, and whole grains that are rich in fiber. Avoid foods that are high in salt and unhealthy fats. Added sugar is another ingredient that it's best to avoid if the goal is to reduce the risk of stroke. Also, a small glass of red wine is thought to cut the levels of the protein that forms blood clots. While focus is on healthy eating and staying hydrated, you are not only reducing the risk of stroke, but also increasing the overall health of your body. Even eating the right foods can assist in helping you lose weight by maintaining a healthy BMI. Several research studies suggest that by choosing healthy food choices that you can also increase your energy and being able to handle stress in daily life more efficiently. It is important to note that by eating unhealthy food options, you can be harmful to your blood pressure, clog arteries, and can lead to stroke. Choosing healthy foods has also been found to help maintain healthy glucose levels and can curb some of the symptoms of diabetes. We are all aware of that the many choices that we have comes to choosing fruits and vegetables. It does not have to be intimidating when going shopping for fruits and vegetables. Local farmer markets are excellent resources to access fruits and vegetables, and they have key nutrients that are, as well as various levels of vitamins and minerals that are required to help our bodies function. The Jacksonville Farmers Market is located at 1810 West Beaver Street, which is a mile west of downtown Jacksonville. In fact, food that is heart healthy is also very good for your brain health and can reduce the risk of stroke as well as cardiovascular disease. High in refined processed foods can increase the risk of stroke in some people. Some whole grain ideas are foods like brown rice and whole wheat breads are great ways to increase your intake of whole grains as well as increase the fiber in your daily food whole grain goals. Examples of fish that are high in omega-3 fatty acids are salmon, albacore, tuna, mackerel, and trout. Omega-3 fatty acids are made up of EPA and DHA, which are prevalent in fish. These omega-3 fatty acid fish are heavily researched to reduce recurrent stroke. Another excellent option is to try to consume lean meats like chicken, turkey, lean beef, and eggs, as well as dairy products like meat and cheese. Please be sure that the dairy products that you are consuming are in the 1% fat family or lower. We have found that the intake of low or fat-free dairy products like milk and cheese may reduce the risk of stroke. All types of beans are considered an excellent source of protein. Beans like chickpeas, lentils have been found to lower cholesterol, blood pressure, and because legumes are primarily low in the glycemic index, making beans ideal for people who are suffering from diabetes. I don't know about you guys, but my favorite bean is the cacao bean, which is chocolate. Because we want to play a part in your stroke prevention, we would like to share with you some dark chocolate during our game of Jeopardy!
Yes. Number one, smoking. It causes thickening and narrowing of the blood vessels. It also increases the substance of plaque, which was described as a fatty substance in the video. And that's important because with plaque inside the blood vessels, it makes it hard for the blood to flow into the brain, therefore causing a stroke. Smoking also makes the blood more sticky and more likely to clot. The next one is heavy alcohol use. Drinking an excessive amount of alcohol can trigger atrial fibrillation, which is a type of irregular heartbeat. And it is important to remember that atrial fibrillation can increase your stroke by 5 times. There's also concerns such as liver damage due to drinking too much alcohol, and this can increase the risk of your stroke by increasing the chances of your brain to bleed. For drug use, course, any type of hard drugs will either increase or lower your blood pressure and your heart rate depending on what type of drug it is, and can cause brain damage and additional dangers such as dependence and withdrawal symptoms, which can be very hard to get rid of. And this slide pretty much sums up what we're going over today. The main things to take into consideration is the two different types of stroke, the ischemic stroke and the hemorrhagic stroke. So for physical activity, it's important for us to keep in mind weight control, because a risk factor for strokes are being overweight or obese. It's also beneficial to drink water, because we need to remember that 60% of our body is made up of water. Physical activity also increases the strength in our hearts and our lungs, which, if you think about it, it does the opposite of what happens during a stroke, which is increases the blood flow, which during a stroke it lowers or decreases the amount of blood going into the brain. Physical activity also aids in the recovery after an illness or an injury, lowering blood pressure and cholesterol levels. Research has found that when stroke survivors add physical activity to their plan into their daily lives, they can reduce the risk of suffering another stroke. It is recommended to do at least 30 minutes of moderate physical activity in your day, or just break it into 30 minutes with 2 15-minute workouts or 3 10-minute workouts. This can be done about 5 times a week. For examples of physical activity, you have gentle activities such as a light walk around the neighborhood, taking the stairs instead of the elevator. I know we have stickers on some of these elevators that tell us to remind you guys, make sure you take the stairs this time, or yeah. And so also gardening and housework is a light activity, and yoga, tai chi, and Pilates, which is very important because a lot of times we are physically active, but we don't stretch, and so this can increase our chances of injuring ourselves or being more dependent on one body part than the other. Some actual active exercise you guys can do is jogging, swimming, cycling, lifting weights, or a team sport. If you guys don't like any of these options, you could play simple games such as tag or hide and seek with your kids, grandchildren, whichever one you have. If you are physically incapable of doing certain activities, you just remember that even lifting a can or a gallon multiple times can be considered an active activity. The one thing to remember is that the normal resting heart rate is 60 to 90, so as long as you are going above those numbers, you should be A-okay.
Alright, so I'm going to talk about reducing your stress levels. So, as the video said, high blood pressure is one of the leading causes of a stroke. One thing we can do to help reduce our blood pressure is reduce our stress levels. So, as you can see, he's pretty stressed out, so let's try not to be him. Alright, some ways we can cope with stress. So, meditation, journaling, the 4 A's, which I'll talk about in a second. Physical activity, you can find a hobby, enjoy a balanced diet, and you can connect with others. So with meditation, the main thing that is important to remember is stay in the present moment. So whatever kind of meditation you're doing, mindfulness, or sometimes you can get like the audiobooks that help you like visualize like imagery and things like that. It's important to breathe and just focus on the present. So writing it out, this is a great way to reduce your stress level. A lot of us, I don't know, like me, I always have 1,000 things running through my head, and sometimes it's just nice to get it out on paper. So, you could get a journal and, have a formal journal, or you can just get a napkin or a piece of paper and just write out whatever your thoughts are. And then with the 4 A's of stress. So the 4 A's are avoid, alter, adapt, and accept. So with avoiding, you can avoid stress by taking control over your surroundings. So you can take a less hectic route to work. It might take a little bit longer, but maybe you won't have to be stuck behind, you know, that person that is on their phone or something. Or you can bring your own lunch so you don't have to wait in line at the cafeteria for food. Or, you know, you can maybe schedule to pay your bills a little bit earlier so you're not super stressed out about, you know, meeting that deadline. Also, you can avoid people that maybe cause you stress. We all have that person in our life that, you know, when we're around them, it raises our blood pressure a little bit. Another thing we can do is alter. So what we can do in our life to alter is we can ask people like that to change their behavior, or we can change our own behavior. Another way we can do that is communicate. And then also we can alter our perspectives. So if you think about something that's causing you stress, if you alter the way you think about it and think, is this going to affect my life in 5 years from now? Or even 5 months from now? A lot of times the answer is no. Sometimes it's not, but you know, a lot of times it is. And then adapt. So we can also just adapt to our surroundings. So one thing we can do, so you can, you know, make some Campbell soup instead of making a full homemade soup from scratch all the time. You know, it'll just save you a little bit more time and maybe save you some stress. And then the last one is accept. So sometimes we just have to accept that certain things in life, they're going to be stressful. We just have to learn to really accept it and to just make certain stressful situations a part of our lives and move on and get through it. One thing that you can do to help accept is make yourself like a mantra, like something you say all the time. So like something like, I can get through this, or you know, a lot of people, they take a Bible verse and use that as a mantra too. You know, so you can do that. Now, yes, this too shall pass. So physical activity, so I'm not going to go over this too much because Ed was awesome and just went over physical activity, but just keep it simple. You know, it could be, you know, just a couple minutes a day, but it will really help lower your stress. Finding a hobby. You know, there's a disc golf course not too far from here. You could pick up some playing disc golf, or, you know, you could, you know, pick up an instrument or play basketball, or, you know, learn how to draw, just anything to kind of take your mind away from the day-to-day stressful life. Enjoying a balanced diet. So I'm not going to go over this too much either because Melissa went over it, but, you know, the main thing is just avoid things that are really high in sugar, high in caffeine, high in high fats. Those are all foods that actually make you more stressed out, even though those are the things that you want when you're stressed. Okay, so now connecting with others. It's really important to surround yourself with people who you do feel comfortable with, who can make you feel valued and take your concerns seriously. And so this kind of stress exchange, it can be really beneficial for your heart. And then laughing too, you know, you can laugh with others and that can be good for your stress. So that concludes our presentation on how to, some healthy habits. I hope you learned some helpful tips on how to help reduce your chances of getting a stroke. So, you know, just eat healthy, exercise, reduce your stress.